Hello everyone, my name is Dr. Mitch Rice, and today we're going to be answering the question, what exactly is a CBC? But before we dive in, as always, there'll be timestamps here at the beginning of the video, so feel free to jump around to whatever interests you the most. So the way this video is going to work is I'm going to be explaining each component of what a CBC is and providing a brief definition. I'll be doing future videos on a couple of these topics to provide a little bit more in-depth explanation, so stay tuned for those. Also, for the sake of the length of the video, I'm not really going to dive into some of the reasons why your CBC could be out of the normal ranges, as there are a bajillion reasons, and yes, that is definitely a medical term, that can cause each component to be out of whack. Anyways, enough rambling. Let's get to it. So what is a CBC? A CBC, also known as a complete blood count, is an extremely common blood test that healthcare professionals order and use on a regular basis. It tests and looks at 10 different components of your blood. These components include white blood cells, red blood cells, hemoglobin, hematocrit, mean corpuscle volume, mean corpuscle hemoglobin, mean corpuscle hemoglobin concentration, red blood cell distribution width, platelet count, and mean platelet volume. So let's start at the beginning of the list and then work our way through it. So starting at the top of the list with the white blood cell count. White blood cells are a specific type of blood cell that are used to fight infection. There are 5 distinct types of white blood cells in your body, each of which has its own discrete functions and tasks in your body. These are neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Next is red blood cell, or RBC. The red blood cell is a specific type of blood cell that, together with the help of hemoglobin, help carry oxygen throughout your body. Next is hemoglobin, or HB. Hemoglobin is one of the major proteins found in red blood cells that help carry oxygen throughout your body. If you'd like to know even more information about hemoglobin, I'll put a link to my video in the top corner. Next is hematocrit, or HCT. This is the amount of space within your blood that is occupied by red blood cells. In the clinical world, this is seen as almost synonymous with hemoglobin in terms of interpretation and its overall meaning. Next is mean corpuscle volume, or MCV. This is the average size of each red blood cell. Next we have mean corpuscle hemoglobin, or MCH. This is the average amount of hemoglobin inside red blood cells. Next we have mean corpuscle hemoglobin concentration, or MCHC. This is the average amount of hemoglobin within red blood cells compared to the average size of the red blood cells. So kind of like a proportionality thing. Next we have red blood cell distribution width, or RDW. This is the amount of variation in size of your red blood cells. Next we have platelet count, or PLT. This is a specific type of cell that helps form blood clots to ultimately stop bleeding. If you want to know more information about platelets, I'll put a link to one of my videos in the top corner. And finally, we have mean platelet volume, or MPV. This is the average size of the platelets. So now that we know a little bit about each component of a CBC, we can talk about why it's important. So a CBC is primarily used or ordered for 4 major reasons. Number 1, to diagnose a medical condition. Number 2, to monitor a medical condition. Number 3, to monitor a medical treatment. And number 4, to simply check your overall health. If you'd like to read even more information about a CBC, please visit my website at www.wellsci.me. Thank you so much for checking out this video. If you have any more questions about a CBC, feel free to get in contact with me or leave a comment down below. Again, thank you, and I will see you all on the next one.